Yeah, we'll stop from Bismillahir-Rahmanir-Rahim. Wassalatu wassalamu ala ashrafil anbiya'i wal mursaleen. Sorry about that. As always, there's always technical difficulties, but we'll start again, inshallah. Can't work out why this isn't streaming, so we've had to do it this way. The slides should be viewable, so just bear with me. But technically you don't need the slides because there's not much written on them. You should be able to follow, inshallah. But first thing, we're starting again, so I just want you to listen to this clip. And this is a clip of a nurse who works in...
I've just come out of the supermarket. There's no fruit and veg. I had a little cry in there. I'm a critical care nurse. I've just finished 48 hours of work. I just wanted to get some stuff in for the next 48 hours. There's no fruit, there's no vegetables. I just don't know how I'm supposed to stay healthy. And those people are just stripping the shelves of basic foods. You just need to stop it. Because there's people like me that are going to be looking after you when you're at your lowest. Just stop it. Please.
Now, when I heard this on Friday morning, I was on the way to work after dropping the kids off from school. And when I heard this, I cried all the way to work. Because we talked about this last time, that there is no real need to panic buy at all. Unfortunately, what's happening is people like her, but also I have patients who are in their 70s, 80s, and for whatever reason, they're alone. And they go to the shop, and all they want to buy is a bottle of milk, some bread, some cheese, some fruit and veg, just the very basics to get by. And when they turn up, everything's empty. And there's people also who unfortunately are not as privileged as us, and believe it or not, they earn £5.83 a week. I'll say it again, £5.83 a week. And they're not as privileged as us to just get up in our car or cars and rock up at any time of the day and clear the shelves. They just don't have that. And so when they turn up, our old friends, people who are struggling financially, and they can't buy the basics, it's just simply not right. So I want everybody to understand something, and that's, look, essential travel has not stopped. Okay, food, produce, necessities like soap or hand sanitizers, loo roll, etc., it will carry on to be supplied because that transport hasn't stopped. Actually, people who work delivering these items are termed as key workers. So there's no real need, brothers and sisters, for us to panic buy. So when you go shopping, what I want you to do is just think about being normal about what you buy, because there's plenty of stuff out there, and if we all shop sensibly, everybody will get their share of what's needed. And only buy what you need, not what you want. I'll say it again, only buy what you need, not what you want. That's the first thing I want to say. The second thing I want to say is that we were supposed to host this in this masjid with the attendees that came last week, but due to circumstances we've had to do it as a closed event and stream online. Alhamdulillah, we never complained to Allah subhanahu wa ta'ala. It's the way it was supposed to be. But what I want you to understand is that this is a new virus that we actually have never seen before or been able to deal with before. So just understand a few points. There's no vaccine for this virus. So we can't vaccinate people to protect them. Secondly, it's a virus. There's no actual treatment for this. Antibiotics simply won't work. So you can't really treat people when they're afflicted with this virus. So if they are struggling and they end up in hospital, it's just supportive care, and doctors do their best. The one thing we do know, though, is that if we follow the trajectory of countries that have really struggled with this, think China, think Italy, think Iran, think South Korea, what we do know is that the one thing we can do to limit the spread of this is social distancing. And unfortunately, medics, there was an open letter written by, if I remember correctly, Dr. Catherine who's a junior doctor working in A&E in London, and she's pretty much on her knees begging the public to take this seriously. Because if you look at London, within a week it went from under 200 to 1,000 cases. And what we do know, if we look at the trajectory of cases from other countries that I've mentioned, is that social distancing is the one thing you can do. So just picture this scenario, and I'll use myself as an example, because I'm conscious that people may get offended, and I'm not trying to offend anybody, but just imagine my scenario. So I'm in work, and due to circumstances I have to see a patient who may not be symptomatic. It could be something completely unrelated why they're seeing me, and I have to see them for clinical reasons. Then I come home. I don't wash my hands, for example, as I should do. I don't take off my work gear, I don't get changed, and I'm very blasé about things, and I just go to the local shop and I don't keep my distance. Or I meet a bunch of friends outside my house and we just, hang out like we usually do, and then I pass it on to them. They might not be symptomatic, because usually the young tend not to be symptomatic, but they go home and they go see their grandfather, who's 70 years old, 72, let's just say. He has a heart problem, and without realizing, just kisses his granddad on the head out of adab, or gives his grandma a hug, and she might have diabetes, and then they fall ill. But this person doesn't realize that they've got it and doesn't adhere to the social distancing rules, gets on a bus or goes to work, is not careful with distancing or shaking hands, etc. And then you've got a bunch of people that he or she's been in contact with who also go and visit people who are vulnerable, because that's what we do, and you can see where the domino effect comes in. And then what happens is that groups of people who really struggle are 70-year-olds and over, but actually the data shows that it's actually 65-year-olds and older, those with diabetes, those with hypertension, which is high blood pressure, those with chronic heart disease like heart failure, or if they've had a heart attack in the past, and also those with respiratory conditions, so those who need inhalers for asthma or COPD, those who basically need inhalers long term. What we've found that's happening across the globe, and it's happening now in London, is that the hospitals are being flooded because people are really struggling because of this virus. But what you have to remember is that in the background of all this, we, as medics, we still have a plethora of patients with ongoing medical conditions that also need to be seen. And essentially what will happen, it'll become like a bottleneck. And some people who need to get into hospital can't get into hospital because it's simply full, there's not enough beds. Now if you go back and just stop and pause and reflect, this could have been avoided. It could have been avoided. And I understand that there's a lot of emotions behind this, but we have to put reason and rational thought over emotions. So yesterday I was on the phone to my aunt, and I'm sure she won't mind me saying, and I said to her, look, no kids, no grandchildren coming to see you. Okay, and if you do, then 2 meters apart, really quick, in and out, no hugs, no kisses, because they could be carriers and you have medical conditions and you're putting yourself at risk. And I know it's heartbreaking, but it's temporary and it's not forever. It's only for a potential maximum, inshallah, 3 months. It could be less. But what I'm trying to say is that what we do know is that the areas that didn't do social distancing quick enough their rates went to the thousands very, very rapidly. I'm not trying to scare you. I'm not trying to, panic you. What I'm trying to say is just try and accept a level of reality here of what we can do and what we can't do. And the one thing you can do is social distance. So just please, for the sake of Allah, follow guidelines that the medics have sent out. And of course, inshallah, with intense dua, we hope that inshallah that we don't follow suit with what's happening in other countries, and it doesn't go as bad as it has been in other countries, inshallah. But I just wanted to say those two things, because as I'm saying this as a medic, I don't think people are taking this as seriously as they should. Every single expert across the globe is saying the same thing, and it's not common for doctors to have consensus. We argue a lot, but I just want you to know this. Okay, so we'll move on, inshallah. So for those of you that came last week, remember what we talked about last time, that this is an overview. Okay, what I want you to do is consult your GP before you make any changes, but just give the GPs a break unless it's an absolute emergency because of the current situation. And remember, A&E, only visit it if it's an accident or an emergency. That's why it's called accident and emergency. It's only for an accident and emergency. So if you do make any changes, just have a think about maybe consulting with your GP when the time's right, just to check about if it will affect you for your own current medical problems and any medication that you're on. This disclaimer was for brothers and sisters who would attend, that I can't give any personal advice, so ignore that bit. Okay, so what we talked about last time is that you can't dissociate diet and exercise with mental health, and mental health with diet and exercise. They're all interlinked. If you have a super rich diet, good nutrition, a really good exercise regime throughout the week, and your mental health is sound, then you have health, then you have vitality, then you have energy, then you have strength. They're all interlinked. You can't separate them. So for those of you that weren't here last week, if I could try and summarize really quickly, in terms of diet, if you follow 3 things, inshallah, you'll be fine. Number 1, have a low carb diet. Okay, especially on the run up to Ramadan, have a low carb diet, especially refined sugars, things that are essentially junk and are really, really tasteful. Unfortunately, and we all know what they are. I don't need to go into any detail. So low carb diet. Number 2, have wholesome foods that are actually nutritious, and try and go organic. And number 3, eat less. Okay. And with that, there's 2 parts. Number 1, try and eat twice a day, 10 to 12 hours apart. If you feel hungry, snack on raw veg or fruit. And make sure you keep yourself well hydrated. And when you do eat, follow the way of the Rasul sallallahu alaihi wasallam, where he said that to the effect that 1/3 for your stomach, 1/3 for 1/3 of your stomach for food, 1/3 for water, 1/3 for air. And in terms of exercise, try and aim for 150 minutes of moderate exercise in the week, which includes brisk walking, cycling, obviously not now, swimming because the gyms are closed, even gardening, anything that gets your heart rate going faster than usual for 150 minutes a week. And what you can do, you can separate that over the week. You don't have to do it all in one go. So 10 minutes here, 20 minutes here, but start low and build yourself up slowly. The key is consistency. Or 75 minutes a week, which is 25 minutes 3 times a week of vigorous exercise. That is the bare minimum what you need to do. Okay? Alongside 2 days in the week of 10 minutes of muscle strengthening exercises. And we talked about kettlebell exercises last time, but that's the khulasa of the seminar last week. And so we're going to talk about mental health. Now, it's important to know why. Before we talk about how to help yourself, it's important to know why. And these are really sad statistics, okay? So 30%, which is nearly 1/3, so 1 in 3 of us, we report anxiety symptoms, okay? It's probably increased now because of what's going on, but I'll talk about this in a sec, inshallah. Okay, just over 10% of Asian men and 1/4 of our women suffer from common mental health illnesses, which include depression and anxiety as the top 2. That's a lot of people, okay? This is the tragic one, over more than 1 in 10, so 30% of us, we suffer from suicidal thoughts. Allah save us from this state. But this is real, okay? And unfortunately, there's a massive stigma attached to mental health in our communities. It's as if we're not allowed to have emotions because it's a sign of failure or lack of strength from within. And unfortunately, some people are even saying that it's you have weak iman. These things are just, it's just hard for someone who suffers from mental health to actually then come out and talk about it. And also, we suffer from chronic stress. I mean, we joke about it, but jokes aside, we talked about it last week. I mean, when was the last time you saw someone who's Asian who's not stressed? Okay, so we suffer from chronic stress. Okay, but we want to be solution focused. Okay, like I mentioned last time, I say to my children, if you have a problem, you've got to be solution focused. Okay, there's no benefit in just bemoaning the situation. Okay, you've got to think about, okay, I'm going to be solution focused and try and sort this out. And it's not about one event. It's not about one massive moment that you have. Okay, it's about small changes which results in massive impact. Like we talked about last time, the key is consistency. If you do things consistently, you'll see the outcome. Okay, and you have to really be consistent in some of these changes. Okay, so this slide, I don't know how well this is transmitted online, but what we've got is we've got a massive queue of patients coming to see us who are quite content in having pills to fix their problems, and it's not their fault. Unfortunately, that's been a cultural thing that we, including myself, we're guilty of, that when there's a medical problem we prescribe a pill, and there's no discussion around nutrition, there's no discussion about the benefits of physical activity, and there's no discussion about how you can control your mind better to get through the problem. And so what I tell my patients is that if you do suffer from depression or anxiety or OCD or health anxiety or whatever, PTSD, etc., that's fine. We can help you with medication, but it will never solve your problem. So until you solve the underlying core reasons why you feel like this, eventually these pills will stop working. But unfortunately, we've got a plethora of patients who want just the pill and nothing else. So this conversation is a little bit different to quote unquote the norm. Now, a lot of people, they have this mindset that I can't change. Okay, they say this. Okay, I talked about myself last time. With our practice, inshallah, when this settles, it will restart. We've become what's called a park run practice, where we encourage our staff members, because you've got to walk the walk and not just talk the talk, right? If we're encouraging our patients to exercise, we have to exercise as well. So we're encouraging our doctors and staff and nurses to, go on a run with patients when we've set up the initiative for them. So one of the doctors came to me and she said, "Are you coming?" And I said, I can't run." And she said, "You can run." I said, "I can't run." She said, "Okay, look, if there was a medical emergency outside, someone had a car crash, would you go?" I said, "Yeah." She said, "Would you run?" I said, "Yeah." She said, "You can run. You've got this mind block." Okay, so if you're thinking right now, if you've got any mental health issues or problems or diagnosis, and you've made yourself believe, okay, that you can't change, you can. It is possible. Okay, just get rid of the I am. It's possible. But remember this: change is a process. It's not an event. Okay, it's not one thing where suddenly you're just going to be this enlightened soul. It's a process. It takes time. It takes dedication. It takes a lot of effort from within. But I promise you, the more you stick with it, you do things consistently, you'll see results, inshallah. So let's look at the scope of the problem. Okay, so this is national statistics, not necessarily related to Asians, but in this country, 1 in 4 experience a mental health problem. I mean, that's just huge. Okay, 1 in 4. And 1 in 5 children live with a parent who has mental health problems. In other words, this impacts them. Okay, it impacts children. They're born beautiful, neutral beings, okay, who are just meant to enjoy themselves and enjoy the world around them. And then when they see their loved ones struggling, they can't calibrate those emotions in their mind, so it impacts children. And since 2006, prescribing has increased by over 100%. So, hands up from my side. Us doctors, unfortunately, culturally, we just used to chuck pills at patients. And so it's not the patient's fault if they have this mindset that a pill will fix me. But, prescribing has increased over 100% in 14 years. Okay? So in 2016, or 17, there was a study done specifically about Asians and what is it about Asians and mental health, okay? And this was their conclusion, that there is primarily a sense of shame and sharam in society, like I talked about the reasons why, and so they end up fearful of expressing themselves and actually being really secretive about how they really feel and how they behave. Also, the causes are deeply misunderstood, okay? We'll talk about causes in a second, but they're deeply misunderstood, okay? Unfortunately, I'm not slating anybody, okay? We need to have ultra-adult conversations about this, okay? Unfortunately, what happens is you kind of get typical responses which are just not helpful. So you get one group, you get some groups of people, just saying, "Oh, pull yourself together, nothing wrong, get real," and that, that sort of attitude, which just doesn't help. And then you've got another group of people who the first thing they say is, "Oh, this is magic," or "This is a jinn, an evil spirit that's come into them," and so forth. Now, I'm not denying these things. These things, we believe that they happen, but it can't be in the vast majority of cases. It cannot be in the vast majority of cases. I'm not saying it's not there, but unfortunately, when you pin your cause on that, it's not helpful for the patient when they're struggling. There's also social pressures to conform. They openly say, if I say to my family or even friends and peers that I feel little bit depressed, it's just you're ostracized. You're just excluded. Okay, and people with mental health are not valued because they're seen as being, quote unquote, not normal, and ultimately marriage prospects can be damaged. So they refuse to to express themselves because essentially people will say, "Oh, don't marry so and so because they're depressed or they're anxious," and etc. etc. And so there's a massive stigma all around because of these reasons. And so essentially what happens is you end up with social exclusion without realizing subconsciously. But excuse me, we do it subconsciously, but the patient who's depressed excuse me, or anxious, they're fully conscious about the fact that there's social exclusion going on here, and it's not right. Now, unfortunately, despite our tradition and the gravity of the sin of backbiting and slandering and gossiping, it's just out of control, and it's terrible. And we simply, we should be at the forefront of not doing this. The Quran, read Surah Hujurat. Read Surah Hujurat, okay? 26th juz. Yeah, 26th juz. Read Surah Hujurat and just read about the social etiquettes that Allah subhanahu wa ta'ala has asked us to. And one of them is not to backbite or slander or gossip. Okay? And our Prophet sallallahu the famous story of the two women who were struggling when they were fasting, and he called them over and he asked them to vomit, and they vomited flesh. And he said these two, one was backbiting, one was slandering. The famous statement of the Prophet sallallahu. And so even though we have this, we still choose, and I'll say it again because it's a choice, no one's forcing you to do it, we still choose to back, and it's not little. So we'll say things like, "Oh, Hamru, oh, did you hear about so-and-so?" That's the door of backbiting. Okay? And what you've got to remember is that people pick up on subconscious signs very, very quickly. Mathalan, if you have decided to talk about somebody behind their back for whatever reason, don't think that you might look at them differently in the masjid than the other one, or wherever you are, and the other might pick up on it. Of course they will. Okay? And then it stigmatizes and it isolates them. And one thing we have to be really clear, brothers and sisters, is that, look, you can be as pious as you want or think you are. You can read as much Quran as you want. You can go as much Umrahs as you want, and Hajj as you want, and stand as much Qiyam as you want, and give as much charity as you want. You can be as taqi as you want. But our ulama have explained that backbiting can literally wipe out pretty much everything that you've done, and you end up with a blank canvas, empty-handed, bankrupt on Yawm al-Qiyamah, on the Day of Judgment, and your deeds are faced to Allah. It's not worth it. Mufti Taqi Uthmani, Hafidahullah, his father, Mufti Muhammad Shafi, Nawwarahullahu Marqadahu, he wrote a risala about backbiting, and I can't remember the Urdu, but it was entitled Sin Without Any Pleasure. His conclusion was that there's actually no internal or external pleasure in backbiting, slandering and gossiping. And what's really ajeeb, the time that we're living in, is that ulama, they're saying that, we would never have imagined being able to backbite just on our own. We would never have imagined that people can backbite on their own, because you have to have two people. Because if you look at the hadith about the warnings of this, it talks about that the one who listens to it is also partner in the one who backbites. In other words, if someone's backbiting about somebody in front of you, you cut them off. And if they still go on and on, just walk away. But our ulama are saying that people can do this now on their own. No one's there, just them, by one click. And somebody's honor is just gone out the window. And we, as individuals, we don't think, we just forward it mindlessly. And your partnership of this, and Allah knows what will happen to you and your actions. So, really just think about controlling your tongue with this in general. So therefore, in conclusion, there's a total reluctance to seek help. And guess what? It's not their fault. Okay, it's our fault, because it's our behavior that's preventing them from seeking help. Okay? And so what happens is people put on filters, and they put on a front, right? Now, people can put on filters, make themselves look good, make themselves look, really full of it, and they're having a good time, but deep down they're drowning with depression or anxiety. And like we talked about, 1 in 10 suicidal. Okay? And that's what's happening right now. So the key messages from this study that they did with us is that mental problems are common, so it's okay. Okay, if someone has a mental health problem, it's okay. And people can and do recover. It's not a death wish. Okay? And it certainly isn't the end of the world. And one of the last points is that anyone can be affected. It doesn't matter who you are, what you are, anyone can be affected. Okay? And one thing that I will say, okay, is that it's definitely not a sign of weak iman. It's not a sign of weak iman. Iman comes in grades. It fluctuates. It's never one state. Okay? Yes, there's always room to improve iman. No one's going to deny that. But it's not a sign of having weak iman. So stop saying it. Okay? And in other words, it's okay for human beings to have emotions. We talked about it last time. That the most difficult year for the Prophet ﷺ was when when Abu Talib passed away, and when Khadija radiallahu anha passed away, his uncle and his wife, okay, his life partner, who he was deeply in love with, and she passed away, and it was after the 3 years of being expelled into the valley of Abi Talib, okay, the 3 years of starvation. So the most difficult time of his life came, and the ulama, they explained that this year was called Amul Huzn, the year of sadness. Okay, when Abu Bakr radiallahu anhu, Sayyidina Abu Bakr radiallahu anhu, and was in the cave with the Prophet ﷺ, and he was worried, he had emotion, and it was revealed, La tahzan, don't grieve. In other words, it's okay to have emotion, but control yourself. Why? Inna Allah ma'ana, indeed Allah is with us, was what the Prophet ﷺ said, and that was revealed, that was revelation. So it's okay to have it, and it's okay to talk about it and look at the compassion of the Prophet ﷺ. It's okay to show compassion on somebody, but also give them a solution. He didn't just say to Abu Bakr radiallahu anhu, La tahzan, stop worrying. He said, don't worry, because Allah is with us. That's solution focused. And our Prophet ﷺ was a genius at this. If only we followed him. So let's focus on depression and anxiety. Okay. So for those of you that can't see on the stream, there's a picture of a bird on an edge of looks like a windowsill. It's snowing, it's hailing, and this bird is getting pelted by cold, hail, snow, etc. Now, just those of you that can see it, if you can't see it, just visualize it, picture it in your head. If you sat there for 30 seconds, you'd feel a bit like upset, right? If you're there for a day, you'd be miserable. If you're there for a month, of course that bird's thinking, man, I can't carry on, type of thing. Now sometimes life throws stuff at you. Okay, sometimes life throws things at you. Okay, Allah subhanahu wa ta'ala gives us tests. Okay, and that's normal. Okay, but the issue is is how do we respond to this test? Okay, that's the focus. Okay, what does Allah want from me through this test? Nothing else. Okay, but going back to the picture, so sometimes life throws things at you and it can upset you, okay, and cause depression. And depression is defined as low mood that lasts for a long time, and, okay, in bold, underlined, I should have put it in capitals, and it affects your everyday life. In other words, there's an impact on your functional ability. Okay, your routine goes out the window. You can't brush your teeth to save your life. You can't even bring yourself to make yourself breakfast or even finish it. You don't bother opening the post and paying your bills. You don't engage with your employer, and your functional ability at work is reducing and you're making mistakes. Okay, this is the key here, that it impacts your functional ability, especially your decision-making skills. And it's very different to just being low in mood because of a certain stress and you can overcome it. It's a consistent low mood lasting for a long time. You're talking months, okay? And the key thing here is that it impacts your ability to function. That's where the key fine line is, okay? So it can give you a plethora of symptoms like feeling sad, suicidal is on the extreme side, aches and pains for no obvious causes. We see this a lot in general practice, that patients come in with excessive pain. It's amplified, so it's not correlated with our physical examination. We gently touch them and they are in agony. And also pain is poorly localized. We'll press on the arm, on the wrist, but the pain's felt across the whole arm. So they can experience unexplained aches and pains. People come for eat and gain weight as a result. Some people lose their appetite. Memory's affected, concentration, and a key one here is decision making. Some people experience insomnia, lack of sleep, fatigue, anger and irritability. This is really, really common, especially in men. Okay, generally, it's common, in my clinic, you get husband and wife that come in and the wife throws the husband in and says, sort him out, he's permanently angry. And I say, he's not angry, he's sad. Okay, men just can't manage their emotions, so they display it as anger. Okay, there's no pleasure in doing usual activities like football or what you usually like doing. Excessive guilt for no reason, worthlessness, hopelessness, and they can all either all be there or a significant proportion. On the severe spectrum is when you have thoughts of self-harm, not wanting to be here, or suicidal, and also attempts on acting on these thoughts. Even if you don't have those, if you have complete loss of function, so we've had patients who literally will not get out of bed because they are that low, and that's a severe spectrum. And some people experience psychotic symptoms, so they have depressive mood symptoms and all the other symptoms that we talked about, but also they hear voices, they see things, they have excessive paranoia and delusional beliefs, and that's on the severe spectrum of things. Okay, let's look at anxiety. Okay, so anxiety, interestingly, what expert psychiatrists and psychologists say is that it feels different from person to person, and there's a plethora of symptoms ranging from anxious feelings, thoughts and behaviour that is manifested as this. So those that can see it, I don't think you'll be able to make out the words, so I'll just go through it. There's symptoms of overthinking, avoidance, I'm not going to go there because it's going to make me anxious, or I can't do this because I can't do it, sweating, stomach issues, so IBS, irritable bowel syndrome, is really common. Patients experience excess acid, excess wind, bloating. 1 minute they're constipated, the next minute they're loose, they don't know whether they're coming or going. Some people experience panic attacks, which is in the form of difficulty breathing, palpitations where your heart beats really fast, shaking, constant need of reassurance, lack of patience, they can't sit still, they're just pacing up and down. Procrastination, delaying things that really need to be done, that's really important, and they can't concentrate, constant worry, headaches, insomnia, memory issues, and they can vary from person to person, but they're generally the symptoms of anxiety, and that's how you recognize it in yourself and in others. But remember, they can both overlap as well. So depression, anxiety, because you can become depressed because of the state of your anxiety, and you can become anxious because of the state of depression that you're in. That's normal, and they can overlap with each other. In fact, it's really common for it to actually overlap. Okay. So what are the causes? Okay, so we'll do depression first in no particular order. So let's talk about now trauma. Trauma is a big one, and currently this is really traumatic for the world, really, what's going on, and it can bring on symptoms of depression, but also for people, if they've had traumatic pasts. And so there's actually a discussion that actually a lot of mental health problems actually stem from childhood experiences. Okay, childhood experiences. But anybody who's been through anything traumatic can trigger it, and that can be, lots of things. I'll just move on. Stress is another one, especially chronic stress. Whether it's self-induced or not, stress is stress. It can lead to depressive symptoms. Poor nutrition can lead to depressive symptoms. There was a study done called the SMILE study. All it focused on was dietary changes, and they saw significant improvement on depression and anxiety symptoms. It's called the SMILE study. Some people, they have a chemistry imbalance in their brain. Okay, often can be because of drugs or genetics. Believe it or not, there's a lot of research going on about smartphones and being addicted to these things because they release dopamine. Dopamine is a happy hormone. It's the same hormone that's released when people take drugs. Okay, so what happens is, you go online, you create say a WhatsApp group, or you've got a Facebook page or Instagram page, and you put something on that's actually really nice, like, hey, look at what I baked today. Okay, and you get 100 messages back. That actually feels good. It releases dopamine. Okay, and then you go on next day and you think, I'll do it again. It felt good, that. So I'm going to put, hey, look what I baked today. And you get 20 responses. That will drop your dopamine levels, and you can have symptoms of low mood. So what you do, the reflex is people go on their phone, and they think, you know what? I didn't get many responses today. So I'm going to send out 10 text messages to my friends. Hi, 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 hi. Because what you're looking for subconsciously, you don't realise, is that message back. When there's a ping, these these pings that you see on your phone, these noises, alerts. Do you know who designed them? The same people that design, in casinos, those gambling jukeboxes. All the noises they make, they're the same people who design, because it's addictive and it's good. It makes you feel good when you hear those things. But the point is that it actually, in the long run, we found patients who actually, especially young, they suffer from low mood and anxiety because they feel that no one likes them because they're not getting as much hits as they used to. You understand? And so that can affect your brain chemistry. So some people, when they get upset, they eat chocolate, because chocolate is proven, it was in the BMJ a few years ago, to make you happy. Some people they overeat, they comfort eat. Some people unfortunately go to alcohol and drugs. Some people, they do go on their phone because but it's not a good strategy to have. Okay, genetics, actually, I was reading only last week. There's a book on the book list that I've added. I'll come to it when it's the time. But there's not much genetics involved in depression. It's very low. It's less than 5%. Okay, it's less than 5%. It's there. Believe me, it's there. But it's less than 5%. Okay, and of course, physical health problems. If you're not in a physically good state, you will not be in a good state of mind. Okay, we've got patients who, for example, take people with arthritis because they lose their independence and they can't go out as much, or they struggle. It does make them feel down, and that's normal. Okay, but they're the 7 top causes. In terms of anxiety, again, we mentioned genetics is less than 5%. It can be a personality issue. Okay, it can be what's called a learned behaviour. Okay, a learned behaviour. I'll give you an example. Okay, when I was 15 years old, okay, my friends said, "Come on, let's go to town." Okay, and there used to be do you remember JD Sports? There used to be you could play basketball in there for free. I don't know if you still can. Right, you could play basketball in there for free, right? And so when it was raining, we used to go to town and we used to go play basketball. So when you're 15, 16, you're Jack the Lad, you want to have a nice hairstyle, right? It's all gelled with, remember the VO5 gel, the cool look, right? And so I refused to wear a helmet. I'm going to mess my hair up, right? So I went, and what happened? I'm on my bike. Guess what happened? I got run over. Okay? I can't remember anything apart from leaving my house, and the next thing I know, I'm in hospital. Okay? And it was really traumatic for me, actually. And I didn't realise how traumatic this was until my children started riding their bike. So my brother, even now, he laughs at me when my son and daughter go on a bike. He's a really avid biker. So when he takes the kids out for a bike ride, he laughs with me saying, "Has your children got their shin pads and their elbow pads and their knee pads?" and you know what? He was being, and he because what happened was when we first used to go out, I would refuse to let him. I used to run with him while he was riding his bike because I was afraid of him falling over. And if you were to look at me, you'd think, what is wrong with you? But what that will do to my children, and it's a good job my brother stepped in and said, come on, guy, you're not going out with your dad because they'll just turn you into an anxious wreck. They'll learn that behaviour, that unnecessary, abnormal, heightened anxiety about going out on a bike and making my kids wear shin pads in case they fall over. So you can have learned behaviour. Common one for us lot is what? Jelly, 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 jelly. Yeah, everything jelly, 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 jelly. You're going to create time anxiety in your kids. I agree with punctuality. That's a noble thing to do. Okay, that's a noble thing to do. But sometimes you can overstep the mark and create time anxiety. It can be because of health issues. If you've got, say, for example, someone's giving you a diagnosis of cancer, Allah save us from it. Of course, you're going to be anxious. What's going to happen to me? Okay, look at now with coronavirus. Of course, you're going to be anxious. What's going to happen because there's so much uncertainty? Abuse can cause anxiety. Okay, abuse can, especially historical, and it can flow through childhood and adulthood, or your personality of just being shy. Okay, but the most important thing is to actually seek help. Okay, and there are plenty of people out there, good people out there, and good organisations, and good online access that you can reach out to and seek help. And that's the primary message of today, is just seek help. Okay, so the obvious thing to do, the first thing to do is, look, don't hide. Acknowledge it. The moment you acknowledge a problem is when solutions can start. Okay, I've had to change the slides because of the current situation, but in the meantime, try and help yourself. If you're on the severe spectrum, as we've discussed, then you have to go and contact your GP. A lot of GP practices have gone online or triaging over the phone, so they don't physically need to see you. They can manage this over the phone. That's only if you're on the severe spectrum. And once this settled, then feel free to see your GP and seek out therapy. So nationally, as far as I'm aware, nationally, there is this entity called Improving Access to Psychological Therapies, IAPT. You can Google it and just type up your borough. So for here, for Trafford, where I live, if you type up IAPT Trafford self-referral on Google, it'll direct you to the self-referral form. You don't even need to see your GP. But things are on hold now. I won't do it now because a lot of things are on hold because of social distancing. They're only doing what's immediate and necessary. But of course, if you're on the severe spectrum, you do need to be spoken to at least by your GP. Okay, but what I'm trying to say is try and help yourself. So there's resources online. So if you can't see the slides, there's getselfhelp.co.uk. Brilliant resource for if you're struggling, or even if you know somebody who's struggling, on how to help yourself. Mood Juice is good. Mood Gym is good. And mind.org is really, really good as well. Good resources for you to use. Especially Mood Gym, that's a really, really good one. A lot of these are free as well. In fact, as far as I'm aware, these are free. Okay, but let's link this to the current crisis. Okay, because initially this was going to be pitched for more long-term management of general depression and anxiety, but I think it was befitting for me to change this for here and now. Okay, so I once came across this, and it's helped me a lot with myself, with life, with work, with stress and pressures that's thrown on you. So we only have control of one thing, and that's ourselves. Okay, you only have control of one thing, and that's you. You cannot control anything or anybody else. So my advice to you is give up. Give up trying to control anybody else that's a problem for you or stressing you out. Give up trying to control external factors. Give up trying to control the world. You can't. You can only control yourself. In other words, you can only control your mind. If you master your mind, you'll be fine. And that's one of the key messages here. Okay? So essentially, and as hard as this might sound for some people, essentially it starts with you and I. Okay? It's up to us to make that change. No one else. I say to my patients, look, I can help you as much as I can with X, Y, and Z. But if you don't make the changes, I guarantee I'll see you again in 3 months having the same conversation. And that's with physical or mental health problems, especially mental health problems. So what I want everybody to do who's listening and tuned into this is just take a moment and just stop. Just hit the pause button, take a deep breath in, and just tell yourself, I'm going to reset things. Because you know what? You can. You can choose right now to reset your mindset. It's a choice. So take a moment. Okay, take a deep breath in, hold it for about 3-4 seconds. Okay, when you stop breathing, you're on survival mode. You don't think about anything. All you're thinking about is, I need to breathe. It's a powerful way of getting you to stop thinking. So hold your breath for 3-4 seconds and then blow out and tell yourself, stop. I'm going to reset. Okay? From today, I am not gonna suffer, because it's suffering when you have these thoughts. Okay? And I want everybody to try your best to completely detach from things that are toxic. Okay? Look, as much as you can, limit social media or checking the news during this period. It's not helpful for you. It will drive you insane. Okay? We've got news feeds 24 hours a day. Okay? You can choose 1 minute, 2 minutes, 5 minutes max in the day, any time of the day, that's the only time I'm going to check what's going on in the news. That's the only time. Just once a day, 5 minutes max, and then I'm off it. Because it can really, really affect you psychologically. If you're constantly hearing numbers increasing, deaths increasing, people struggling, it will affect you psychologically. Okay? So one thing I want you to do is try and limit your news watching or reading the news to 5 minutes a day max. That's all you need. You don't need anything more than that to be well informed. You don't need more than 5 minutes. Trust me, you don't need more than 5 minutes. The other thing is look, I don't like talking like this, but I feel like I have to. Unfortunately, there are people within our circles who are simply toxic. Okay? They are simply toxic. Okay? Some people, they can make you feel terrible within 30 seconds. Some people can make you feel amazing within 30 seconds. And you know who they are. Okay? If anybody is toxic for you, speak with ulama first. Don't do it on your own. Speak with the scholars, because there's religious lines with this. Okay? And just ask, how do I behave, or how should I be, and how do I draw healthy boundaries with people who are toxic for me? Okay? So think WhatsApp groups, for example. Okay? They can be very, very beneficial. They can be. There's a WhatsApp group on our street that's been set up saying, if anybody needs anything, contact this. But that WhatsApp group shouldn't have messages of, oh my God, coronavirus, and updates on what's happening here, what's happening there, and scaring the pants out of people. So if you are on, if anybody is doing this, essentially stop forwarding messages that are just not good. Because at the end of the day, look, there's some people out there who are alone. There's some people out there who are old, and the only way they can communicate with the world is on these devices. But if all they see is just negative information all the time, and it's heightened, it will drive them insane. Okay? So just have a rule of thumb that from today, I'm only going to check the news 5 minutes, and I promise myself I am not going to forward anything that that is really, really just not helpful in this crisis. And we all know what that is. Okay, no one needs to define it. We all know what that is. But I'm going to stop. And if anybody does it, I'm going to take the courage to not send them a message, to pick up the phone and say, bro, I love you for the sake of Allah. I'm telling you for your benefit. This made me feel more anxious about the situation. Can you not send this again, please? Okay, if you say it with pyar and muhabbat and from the depths of your heart, it'll go a long way. Okay? Because essentially what happens is we have selective attention. So I want you to pay attention to this. Okay, when you buy a new car, what do you see? You see the same car everywhere, don't you? You buy a new car, you go out to drive, and then you think, oh my God, everybody's copying me. Everybody's bought the same car as me. Okay, that's called selective attention. And what happens is that sometimes when you're not in a good place, so think chronic depression and anxiety, think coronavirus as well for the acute, what's happening now, you are on a heightened level of paying attention to everything that's related to it. Okay? Now, when that happens, okay, it will affect you emotionally, it will affect your thought patterns, and it will affect your behavior as well. Okay? So just have a think about, am I selectively paying attention to things, or what? Okay? So just, for those of you that can't see, we're talking, the next slide is about something called CBT, which is cognitive behavioral therapy. So cognition is the way we think. So we think because of life experiences, okay? Childhood, life experiences, etc., etc. Okay? Behavior is how we behave as a result of the way we think, okay? And the therapy is to try and reset it, okay? therapy is the way of how you reset it, how you reset that mindset and change perception. So let me give you an example away from say coronavirus. Okay, so just imagine a typical morning where you want to get kids to school, and you're running late, and everybody's saying jaldi, 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 right? And you're just about to leave, and you need to get to work as well. Okay, and then your youngest, who's say 3 years old, is just playing about, and then all of a sudden the youngest, decides to wee himself. Okay, and you desperately want to get out. Okay, it happens usually in this order. First, it starts with an emotion. So your emotion's going to be quite annoyed, angry, apprehensive, even anxious about the fact that you may be late. Okay? Then move on to your thought. Your thought pattern would be, oh my God, my kid's going to be late. They might get a detention. They might get told off for it. Oh my God, I haven't got enough spare clothes. Oh, this is ridiculous. What's happening to my day? It's ruined. These thoughts will go on in your head, and then you behave in a very, very unbefitting way. So if you think of this holistically, you'll notice that your speech will become quite louder, maybe faster. Your muscles will become more tense. Your breathing will be more heavy. You might even feel your palpitations, and you may come across as an army general trying to sort everybody out. And essentially what happens is that cycle continues until and unless you stop and take check on yourself. Okay, so that's CBT in a nutshell. So let's link this to the current. Okay, so this was sent to me only on Friday. There's a group of GPs who are supporting us because it's affecting doctors psychologically as well, not just you, you're not alone. Okay, so if you can follow it, I don't think you can see it actually looking at the screen, but I'll try and talk it through you. So imagine the scenario. Okay, you've just heard an update that, oh my God, X amount of people have just died in this country. Okay, what may happen in terms of your feelings is fear, uncertainty, anxiety, anger, panic. Okay, it may trigger thoughts of overthinking, ruminating, hyper-awareness of your own symptoms, thoughts of we're all going to die, thoughts of I can't do this. It may affect then your behavior to compulsively seek out information from social media and news, like non-stop. You may stop usual activities because you're too worried to do it. You may increase in your self-checking, like some people, they just check their temperature incessantly. Okay? And then it may affect you physically in the sense that you might be hyper-aroused. You might experience a tight chest, not because you have symptoms of COVID, but because you're actually anxious. Your muscles might start to ache. You might question yourself whether you've got a fever because of these things. It will affect your sleep. And the cycle continues between feelings, thoughts, behavior, and physical symptoms. And it's like a vicious cycle. Okay? But what the strategy is if you stop and breathe and try a few things, you could curtail these in one go. Okay, so for example, let's start with feelings, okay? And I'm sorry you can't see this, it's just the camera won't show it for some reason. But if we start with feelings, if you do have feelings of fear, which is normal, okay, so don't beat yourself about it, of fear, uncertainty, anxiety, anger or panic, just try this, just tell yourself, you know what, I'm not alone. There's people out there who are also feeling this, okay? Try and reach out and connect and share your feelings, okay? Just ask someone to soundboard your feelings and to try and help you calibrate. But like we talked about, people who aren't toxic, okay? People who don't make matters worse. If you have thoughts of overthinking, okay, ruminating, hyper-awareness of things, thoughts of we're all going to die and everyone's going to get it and this is the end of the world, okay? Why don't you try distraction? And I'll come to this. Why don't you try reframing? And I'll come to this, okay? Why don't you just take one day at a time? Literally, take one day at a time. Don't think about the past. Don't think about what's happened. Don't think about the future because you have no idea what's going to happen. Just think about here and now and what's going on with me right now. If you do have behaviors like compulsively seeking information like social media or news, why don't you do this? Why don't you limit your access to 5 minutes a day no matter what? And only use quality sources, okay? Only use quality sources that give you accurate information, not sensational news feeds, okay? Quality sources. If you found that you stopped doing usual things, engage back into those activities. And again, I'll come to this one by one, okay? If physically you feel hyper-aroused or you've got a tight chest or you feel like you're breathing fast, or you're not sleeping. Okay, exercise does help. Okay, exercise does help. Physical activity is proven to improve your mental state. Okay, focus on your breathing. Okay, we'll talk about breathing in a sec, about how to do that. Mindfulness, which is being in the moment, and make sure you have a good, sleep hygiene pattern. We talked about this last week. Turn your phones off 1 hour before you go to bed. No phones 1 hour before, 1 hour after before you go to bed. Just turn them off. Okay, turn them off. No screen time at all 1 hour before you go to bed. Okay, have a warm bath. Soak yourself in with lavender oil, for example. Put some lavender oil in the bath, in a hot tub. Have a soak before you go to bed, or have a shower. Okay, have some chamomile tea before you go to sleep. It helps you sleep. Okay, just relax before you go to sleep. It will help you sleep. But you try all these things, and the thing is consistency. Unless you do it constantly, it ain't going to work. Okay. And remember one thing: if you're going to take one thing away from this discussion about emotions, feelings are not facts. Okay? Feelings are not facts. Okay? And facts are friendly. So if you factualize things, if you rationalize things, you'll see that your mind will be able to calibrate. Okay? So the first things first, I want you to challenge notions. Like we talked about, just stop. If you feel overwhelmed about what's going on, just stop. Take a deep breath in and try and really imagine you've got a balloon in your belly and you're filling that balloon. Okay? Take a deep breath in and fill that balloon in your belly. Okay? For about 3-4 seconds, and then breathe out as if you're deflating that balloon in your belly. And what you'll notice, and if you want to try it, but what you'll notice is that when you breathe like that, you actually stop thinking because you're on survival mode. Because when you really focus on your breathing and you think, I need to breathe, I need to stay alive, your brain doesn't allow you to think about things as excessively as you do. And then what I want you to do is zoom out. Okay? And we're doing this with colleagues at work. Zoom out. Let's put things into perspective. Alhamdulillah, we're not in China, we're not in Iran, we're not in Italy. Alhamdulillah, we're not in those categories. Okay? And inshallah we make dua that we will never ever enter into those categories. Okay? Zoom out. What's going on here? Okay? Put things into perspective for yourself and others. Actually, I'm okay. Okay? You cannot get coronavirus from watching it on the news incessantly or being on social media. So just stop, zoom out, imagine a bird's eye view. You actually don't have coronavirus, alhamdulillah. And others around you don't have it, alhamdulillah. So I'm going to focus on today. I'm not going to focus on what's happened. I'm not going to focus on what could be, because you don't know. I'm just going to focus on today. And if you keep doing that exercise consciously, you'll find yourself calm down. You will find yourself calm down. In fact, if you have, say for example, an anxiety about or whatever, do this. You'll be able to put things into perspective very, very easily. Okay? And let me give you some tips, okay? Again, first, acknowledgement. I'm really big on this. It's okay. We're feeling the same. It's okay to feel like this, okay? Again, I'm saying it again because I need to limit your exposure to news and social media completely, okay? Be compassionate with yourself. When you love someone, you do anything for them, won't you? You'll make sure they sleep well, they eat well, they look after themselves, you'll look after them. Do that with yourself. Not in a narcissistic way, okay? Not in an egotistical way at all, because that's detrimental for you, spiritually as well as mentally. But start to love yourself. What I mean by that is look after yourself. Again, not in a narcissistic way at all, okay? Because it's destructive. To have arrogance, to big yourself up is destructive for your iman. Your spiritually it's destructive. But be compassionate with yourself and look after yourself. Have a good diet. If you have a good diet, you will feel better. If you maintain an exercise regime, you will feel better. If you have a good sleep pattern, you will feel better. Coronavirus or no coronavirus, whatever mental health issues you've got, you will feel better. But it starts with having compassion with yourself. Okay? Draw healthy boundaries. Learn to say no if you feel overwhelmed. It's okay. Okay? It's okay to draw healthy boundaries. And have a good supportive network. People who are supportive, not toxic. Yeah? People who are supportive and not toxic. Okay? Really important to have that. Okay? A few ideas. Okay, look, I know we're social distancing, but you can go out. Okay? You can go for a walk. Okay? As long as you're not in clusters, as long as you're not in, groups, or, maybe go out in pairs. Okay? As long as you're not with someone who's vulnerable, who's over 70 or has a medical condition. I mean, they can go with their spouse, or someone, just one person, but stay 2 meters apart as you walk. If you want to take your grandma out, for example, and she's got no one but you, just stand about 2 meters apart and go for a walk. It's okay, get some air, it's good for you. The weather's actually nice now. The sun's coming out, isn't it? It's okay. Yesterday I went for a long walk with my wife and kids, and it was good. And what was really nice, what was really nice? Is that we saw lots of people out there walking for a change. Instead of being glued to screens or incessantly shopping and buying things for no reason. It was actually nice people. I saw a dad playing with his son football, and it was just really nice watching him just have fun with his kid because everybody switched off. Okay, if you can't go out for whatever reason, then have daily exercise regimes at home. Okay, no matter what, every day, 10 minutes, I'm going to do this. We talked about HIIT exercises, remember? Okay, do low grade ones. Don't do anything, because you can't really ask your doctor these days if I can do it, because they won't bring you in to check your blood pressure and stuff like that because it's unnecessary. But just do low grade exercises at home, like just do sets of lunges or squats or press ups or running on the spot. 10 minutes. I'm just going to do this. 30 seconds on, 30 seconds off. 20 seconds on, 40 seconds off. The minute cycle. Okay. Why don't you do something creative or constructive? Okay, it distracts the mind. Okay, draw. Okay, drawing is really, you can't get it now, but we used to be able to prescribe art on prescription, send people to art classes if they were depressed or anxious, because it was really therapeutic. Even if you can't draw, it still is therapeutic. Draw or paint or garden. Okay, as much as we hate it, Asians, gardening is actually really, really good. It's good for physical activity, but it's also good for creativity and doing something constructive. Or do some DIY, but just do something that engages your mind. Okay, why don't you do some soothing activities? Just have a soak in the bath if you feel overwhelmed. Okay, have a warm drink. Okay, listen to the Quran. Quran's amazing. How many times have you felt that, oh God, this is just I've had a really bad day, and you listen to Quran, even if you don't understand it, how soothing is it? It's amazing, isn't it? Now, what would you think it would be? What would you think it would do to you if you could understand it? If that's how it makes you feel when you don't understand it, how do you think it will make you feel if you do understand it? It's infinitely greater. Okay? Or do anything that calms you. Okay? Within reason. Okay, I don't want to hear your doc said do anything that calms you, so I'm going to do some drugs. I'm not saying that. Not anything, okay? Things that are sensible. Help people. Create a sense of giving. Okay, volunteer for your street. Look after your neighbours and vulnerable. Check up on them. Within distance. Remember that 2 meter rule. Are you okay? Okay, are you okay? How are you? I've got a couple of vulnerable neighbours. Both of them are self-isolating. It's upon me every day to go and knock on. Are you okay? Can I get you anything? You need anything from shopping? Do you want to go out for a walk? Are you okay? Just even if they're okay, just talk about something that's completely unrelated. It brings joy to people. Okay. Now, what we found is that people who give, people who give to the world, they tend to be the most happiest. Regardless of what's going on in their life, people who give to other people, okay, they tend to be the happiest. Have you heard of this? Change your story, change your life. Okay, what I mean by this is that some people, their life is, you've met someone who's permanently angry? See, this is a closed event for people who are online. There's only a few people here, and we're 2 meters apart. Don't worry. They're laughing because you know them, don't you? No matter what, they are permanently angry. There's just nothing you can do to make them. But there's some people who are permanently happy. It's true, isn't it? There's some people who, no matter what, it's never good enough. They're always complaining. They're always moaning, no matter what. That's their story. Okay, that's their story. Now, the thing is that you can change your story at any moment in time. You can say, right now, I'm going to cut this off. Right now, right, that's it. Me, no more anger. Because it's a choice. Me, no more moaning. Okay? Change your story. If you resonate with this, have a think and just change. And essentially, this is a good time to realign your focus. And this is a good time to reassess. Because you know what, people? Things are going to slow down. They already are. They're stopping. There's quote-unquote not much to do. We're stuck in our houses, etc., etc. But what a perfect time to reassess and realign your focus. Okay? Perfect time. And let me help you with this, okay? So, I hope you can see this online. But this is called the Wheel of Life. Okay? A lot of people use this in mental health, okay? let's face it, there's only a few areas in our life that really matter. Okay? A lot of the things that we get really, really focused on is just not beneficial. It's really not going to change our lives. Okay? We have to appreciate this. There's only a few things in life that if you master them, you will feel, mentally, you'll feel good. Okay? Now, what I want you to think about is just think about this. If you knew, just take coronavirus away, if you knew you only had a week to live, okay, I know that we wouldn't stress about things that drive us crazy. You wouldn't let half the stuff get to you that would get to you, and you'd choose to focus on certain things. Yeah, obviously, you get on a plane, you go to Medina, and you just sit in the road there until your time comes. But the point is, you don't know when this will happen. So what I want to suggest to you is just have a think about that. Why wait? Why wait for that catastrophic moment that, oh my God, I need to focus on things that really matter? And what really matters in no particular order. Your health matters, your wellness, your strength, your vitality. If you're in good shape, if your body's in good shape, believe me, it will show up in every sphere of your life. It's something that you have to really give it your all so you can be in a good state, good shape. It's really important. Okay? Wealth. What I mean by that is having enough, not having tons of money. There's no point being the richest man in the graveyard. There isn't. Okay? Unfortunately, we're in a zamana now, and it's really interesting that, when you hear about the financial crisis, right? My neighbor was talking to me about this. She said, and she's not Muslim, she said to me that, it's really interesting what's happening now, because what should happen is that your generation, as in me, will think twice before we buy things. And one thing that we've conflated is wants and needs. There's a difference between what you want and what you need. And essentially, you should aim for what's enough. What do I need? Not what I want. Okay, because you'll never, like my manager, who's a devout Christian, she said to me once, she said, it doesn't matter whether you earn £1,000 a month or £10,000 a month or £100,000 a month. I was like, what are you talking about? She said, because you'll find something to buy and it will never be enough. You'll what? You'll find something to buy and it will never be enough, and you'll never be content. So just have a think about, okay, in terms of my wealth, I just need enough, okay? I don't need to, be a millionaire, okay? Growth. Am I growing in my career? And what I mean by that is do something meaningful. Okay, unfortunately, there's people out there who are miserable in their careers because they don't feel like they're growing in their career because they're not doing anything meaningful. And you can change at any point. I have a friend who worked, this is true, I have a friend who worked in a grocery store. And he thought, I ain't doing this for the rest of my life. He was 40 years old at the time. He went, did his A-levels, did a medical degree, now he's a doctor. I have another friend who did an arts degree. She was a registrar in my training when I did general practice training. She did an arts degree, okay, and she thought to herself, I don't like this anymore, I want to be a doctor. And she became a doctor. Okay? And she was actually quite old at that time. Not old, but old considering in the age of going to university. I had another trainee who was a psychologist, and he thought to himself, why can't I be a doctor? And he became a doctor. Now, I'm not telling everybody to be a doctor. What I'm trying to say is that these stories is proof that you can change your direction of your life at any point, because it's possible. Okay, but the key in career is that in terms of growth in your career is that you're doing something meaningful, beneficial to the world. Okay, or you feel like you're learning in life. Okay, you're learning in life. Okay, what do we call that? Tazkiyah, purification of the soul. Islam has two entities, external, internal. External is the outward manifestation of worship, the salah, hajj, etc. Okay, then there's internal, where our ulama of the scholars of the qulub, of the heart, have explained the concepts of what? Ikhlas, humbleness, contentment, gratefulness, patience. That's how you feel like you're growing. Okay, that's an important part of your life that you need to focus on. Contribution to the world. Okay, as simple as it sounds, if you contribute and you change someone's world, it will help your own well-being. Okay, connection, spiritual guidance, everybody needs it. This is written by a non-Muslim. Okay, the two biggest factors, okay, in a human being's well-being, actually, according to some who aren't Muslim, is actually spiritual growth. Okay, this is a perfect time to say, I need to reconnect to Allah. I do. Look, Okay, it's temporary, inshallah. It'll go back to normal soon. We'll be back in our masajids. But just ask yourself, did I give shukr when I went to the masjid? Was I present with Allah when I was in the masjid? Did I just do it as a tick box? Got to get it done. It's done. Was that my attitude? You've got to think about things. Reflect now. That look, now I'm going to have a lot more time. What is my relationship like with Allah? What is my relationship like with the Prophet ﷺ? How close am I to his way, to his being, sallallahu alaihi wasallam? Really important to focus on these things. Relationships. Listen to me, brothers and sisters. Okay, the most juice in life comes from intimate relationships. You have to work at it. When you've got a life partner, spouse, husband, wife, if you're struggling, look, there's nothing stopping you now to say, look, let's go start again. Blank canvas. Forgive me, I forgive you. Whatever's happened has happened. Let's start again, because you know you can, and this is a perfect time. But sit together and emotionally connect. What do we want out of life? What do you want out of life? What do I want out of life? How can we make this work for each of us? You can do that right now. There's nothing stopping you. So relationships with your friends and family, if anybody's cut off from someone, and don't cut off from people, you know, we talked about toxic people, but speak to ulama, but generally don't cut off from people, especially for stupid reasons. If anybody's cut off with parents, brothers, sisters, uncles, aunts, blood relatives basically, this is a time to reconnect and say, look, can we start up again? There's nothing stopping you, because that's where the most juice in life comes from. Relationships, okay? There's a hormone called oxytocin. It's released when you have a good time with people, especially loved ones, okay? And also with yourself, you have to have a degree of self-respect and self-love, but not in a narcissistic way. Not in a way that's just, hey, look at me, Instagram, Facebook. I mean, having compassion with yourself and looking after yourself. It's okay to look after yourself. Not in a narcissistic way, okay? It's detrimental to you spiritually. And it all takes having a different set of mindset. So this is big in education. Growth mindset versus fixed mindset. I won't dwell on this. Google it if you want to. There's loads of stuff out there. But just have a look at what's the difference between growth mindset and fixed mindset. Essentially, you just got to tell yourself, I'm on a journey here. Okay? I'm on a journey. And my journey is going to have ups and downs. That's not the problem. The issue is how am I going to manage this? What does Allah want from me? And if you want any help with this, read the stories of the Anbiya. The Quran is full of it. When the Prophet ﷺ was in his most difficult period, which two surahs were revealed? Surah Yusuf and Surah Qasas, the story of Musa alayhi salam, what they went through, to give tasalli to the Rasul ﷺ. Okay? And you will not find in these surahs the Anbiya complaining, moaning about the situation. Okay? It's an eye-opener for everybody. They had growth mindsets. Okay? They had, just take a look at it. Some interesting reads. Again, I have to do a disclaimer. I don't have any shares in these companies or publishers of these people. I have no affiliation with them. Okay? This completely changed my practice. It's a book called Healing Without Freud or Prozac by Dr. David Servan Schreiber. What he did, he got fed up. He was on this was a Harvard consultant, psychiatrist. Okay? Now he's in Paris. He said, I was on a ward round, and there was an old lady who fractured her hip. And the orthopedic surgeon said, she's fractured her hip, we've sorted it out, we can't let her go because she's depressed, can you give her some pills? So he went, saw her, did what he needed to do, and then he got a bleep from the consultant surgeon saying, what are you doing? You've wrote down to the lady, my plan is to treat her depression, I told her to get a dog. And he said, look, this lady has lost her independence, she's on her own, she's going to struggle, she's going to struggle getting out, and she's going to be stuck between four walls, and I'm not going to dose her up and turn her into a zombie. If she has a sense of self-worth by looking after something, she will probably do really, really well. So she's going to get a dog, right? And he, in the khulasa of his book, aside from what we've already talked about, addressing diet, even he says, this is a consultant Harvard psychiatrist, you have to have a super rich diet. Rich, nutritious diet, not junk, okay? You have to have good lifestyle choices. You have to have a good exercise regime and a good sleep regime. But what he talks about, three things. If it resonates with you, it resonates with you. If you've had trauma, you need to seek help and therapy and address it. You need to. Because until that's calibrated in your mind, it will be like a festering sore and sometimes like a dormant volcano that will erupt now and again. You need to sort that out. He says you need to have a purpose in life. And he's not even talking about some theological religious flex. He's saying you need to, why am I here? What am I doing? What's my role on this planet? You need to have a sense of meaningful purpose. Okay, and then he says you need to have unconditional love. The human being's need is to have unconditional love, and that unconditional love has to come from certain entities, which is parents, grandparents, brothers, sisters, children, spouse, and close friend circle. And if you don't have that, you need to seek it out. There's nothing stopping you, especially now, what's happening right now. If you've fallen out with a loved one, there's nothing stopping you getting on the phone saying, you know what? You know those years that we had together, they were amazing, and I just want you to say thank you. That we had those 4 or 5 years together. Or if you have fallen out with your parents, there's nothing stopping you ringing them saying, you know what, Mum, Dad, I was thinking about this. You know, I really love you. I'm sorry what's happened. There's nothing stopping you from just reconnecting with people, because it's a human need, okay? Next book is something called Spark. We talked about this last time. It's the science behind the benefits of exercise on mental health, okay? Remember, I'm just conscious of time, we talked about this last time. Remember my patient who was depressed, suicidal, his wife had an affair, they were separated, he went from being in a happy marriage into 4 walls in a small flat, ugly divorce, etc. He didn't want to take pills, he didn't want to see a therapist. I convinced him to run. He runs 8k a week, and he says to me, if you didn't convince me, Doc, I'd be dead. Okay, and that was after I read this book. Okay, it's powerful stuff. Okay, so it's good book to have on your bookshelf, and in fact it will help you function. Your brain will be more awake as well. This is an interesting read, Inside Out. So remember this, human experiences unfold inside out, not outside in. Okay, remember this. If you get the Qula says this, it's the decisions that you choose to make, not the conditions you meet. Okay, you can be faced with the most difficult of conditions, but it's the decisions you make on how to respond in those decisions that define it. And that can make you feel either positive or negative about yourself or the world around you. Okay, really important read. Have you heard of the chimp theory? Okay, essentially what Steve Peters, he's the psychiatrist for the Olympic cycling team, British, and they won straight golds in I think the most recent Olympics. Okay, he was a psychiatrist behind this. This is massive in sports psychology. But what he talks about, it's like the nuffs. He said he calls it the chimp. So what you have is you have emotional brain, which is 5 times faster than rational brain. In other words, the first thing that's going to come to your mind is emotion before rationale. Okay? So I'll give you an example. Imagine we're driving home, right? And you're driving, you're desperate to get home for whatever reason, and then I'm driving, and then I just pull up in front of you and cut you up and decide to do an emergency brake, right? How would you feel? You'd be really cheesed off, wouldn't you? Sometimes you'd beat the horn, maybe some fingers will go up, you'll scream and shout, okay? That's your first primary response. But what if at that moment I could send you a message saying, I'm really sorry, bro, that I did that to you, but I am desperate to go home because my mum has just been admitted into hospital, I need to go and see her. Automatically you'd be like, you know what, bro, khalas, go. My emotions are over. You go, and I hope you make it. What he talks about is that you need to rein in the chimp, your emotional brain, because it's 5 times faster. Okay? It's a really, really good read. But it's essentially the concept of nafs. Okay? Really good read. Oliver James, one of my favourite authors. Okay, he's a child psychologist and also a journalist. This book, if you want to understand Zuhud, okay, if you want to understand it, the concepts that our Prophet ﷺ was talking about, okay, this book will help you. Okay, it will really help you. Because what his, and he wrote this about, I think, 10, 15 years ago, what his beef is that he calls it affluenza. He calls it a contagious middle-class virus causing depression, anxiety, addiction, ennui, a global tour of infected minds by a renowned psychologist in search for the secret of being successful and staying sane. And his khulasa is that people's focus on life has changed to just becoming super famous, super rich, super funny, super everything, and forgetting actually what really makes you feel fulfilled and happy in life. And in that process, he says, it just causes significant damage to you psychologically. Really good read. He's also wrote a book called How to Develop Emotional Intelligence. Okay, this is a must for anyone if you want to understand your emotions. Okay, where they stem from. Essentially, his idea is the vast majority stem from childhood. Okay, it's not that you go and have beef with your parents. You just understand what was your childhood about, and then how did that impact and affect you. Okay, it'll give you insight of you and how you behave. Really good read. And then he talks about solutions of how to lead a fulfilled life. And like we talked about the wheel of life, remember, Most things we spend our time on focusing on will not make us feel fulfilled. It won't. As simple as it sounds, it won't. And this is what he talks about. Okay? Other good books, there's South Asian Health Solution, which we talked about last time, and The Stress Solution by Dr. Chatterjee. He actually has a website. Again, I don't have any part of his business, okay? He's a fellow GP in our patch in Trafford. He has a really good website and a lot of good podcasts. Really good guy to listen to, actually. Famous for Doctor in the House. So, didn't mention stress. So I was thinking, should I take this? This was in my original presentation. Should I take it out? Should I keep it in? But I'll keep it in, because put coronavirus aside just for 1 second. We just do it to ourselves, don't we, as Asians? We just stress ourselves out. We do. This is my take on it. Okay. I appreciate life pressures in everybody. La shak. Everybody has life pressures, and I get that. That's normal. But we're people of high expectations in pretty much everything. Okay? Just ask yourself, do we take on too much? You don't have to save everybody else's life. 1 or 2 that you can manage is fine. But you don't have to do the world. Okay? Especially if you can't cope, and especially if your health's been affected, or people that's supposed to need you is being neglected. Especially. Okay? Just ask yourself, are my expectations too high? Are my expectations too high? Okay? Especially in people. We have massive expectations in others. One of my friends, he's a mufti down south, he said to me once, years ago, beautiful advice. He said, don't have any expectations with anybody. I was like, nobody? He said, nobody. Parents, children, wife, brothers, colleagues, have no expectations. He goes, you'll be left disappointed. Sahih, haqiqatan, that's true. It's completely true. No expectations, okay? And then ask yourself, what's your orientation in life? What's your focus? And our focus should only be one thing. And we know what it is, okay? And why on earth do we stress about our great-great-great-grandchildren? And I don't mean deen. That's a good stress, because that's growth. When you worry about matters of deen, that's growth. That's spiritual growth, okay? That's actually praiseworthy. But why on earth are you worrying whether your great-great-great-grandchild has a house? You know, it just doesn't make... Just don't. You miss out on now. You don't live. You only have now. You don't have anything else. Okay? And remember, with stress, put coronavirus to the side. Any stress, remember, 10% of it is actually what's happened, and 90% is actually the thoughts behind the stress. What thoughts go on in your mind? So what I want you to do is remember one thing, okay, with stress. Sometimes we create our own stress through expectations. Don't have any expectations with anybody or anything. Okay? No expectations. And I mean this. Have no expectations with Allah. Doesn't owe you anything. He loved you enough to give you life. That's enough. Alhamdulillah. Do you understand? We have no expectations. We ask for His fadl and His rahmah, but we don't expect or demand Allah. And then what would happen? You get disappointed. And that's why people are uttering things right now that it's just like, no, don't talk like that. Ever. Our ulama, they say, لا تدخل في قلبك مثقال ذرة. مثقال ذرة. Don't ever let an atom's worth of what? Enter your heart. سوء الظن بالله. A bad opinion of Allah. Never. And this is what happens if we don't choose to read stories of the Anbiya, the life of the Prophet ﷺ, the life of the Sahaba, and what they went through. None of them uttered anything like why. Never. There's a poem in Imam al-Ghazali's Minhaj al-Abidin, The Way of the Worshippers. You know, you've got time now to read books, read it. سبقت مقادر إلهي وحكمه. My Allah, my God, the fate has been written, and His order. فَافْرَحْ فُؤَادَكَ مِنْ لَعَلَّ وَلَوْ. So relax your heart from what if or perhaps. Just hand it over to Allah. Look, I said this last time when I did this in Majanoor. I said, look, I know people who have been through the mill, and they confidently say that, you know, that parishan, that difficulty that I went through, it was the best thing that ever happened to me. It was. I couldn't see it then, but I can see it now. It was the best thing that ever happened to me. It gave me a spiritual enlightenment. So slow down, okay? Just maybe stop this jaldi. Slow down. Keep as calm as you can. Remain positive. Take it easy on yourself. Hawwin ala nafsik. Just go easy on yourself. Relax. Unplug from these devices. Enjoy life and spend time with people that actually you should be spending time with. Have a bit of fun with it as well. There's no one saying you can't have fun. Breathe. Just stop and breathe, okay? Relax, go outside, meditate. What do we call meditation? Muraqabah. Okay? Why don't you do this right now, those that are listening? Just close your eyes, put your hand on your heart so you can focus on speaking from the heart, and just close your eyes and just count your blessings. I'll help you start. Why don't you just close your eyes and say, Allah, you loved me enough to give me life. You loved me enough to give me life. And just close your eyes and just think about all the blessings you have. It can be whatever is a blessing for you. Think about your eyes and the fact that you have colour vision, and you can process information and have an emotion with that information, or that you can breathe without, or swallow without choking, or that you have a pair of hands. And because if you speak to people who don't have these things, they'll tell you how much you should value them. Or just think about whatever you can think about, but just spend a minute or two counting them, and you'll see how your brain will just calm down a little bit. Okay? So one prescription, why don't you try it? Maybe at night, tonight, after Isha, okay, lights out, on your own, find a room where it's just you, face Qibla, go into deep breathing. Okay, the way you do that is you hold it in, you fill your belly, you hold it in for about 3 seconds, then you breathe out for about 3 seconds, so you slow your breathing down, and just count your blessings for at least a minute. Put a timer on, and just watch what happens to your mind. Okay? Just watch what happens to your mind. Try it. It's about being in the moment. It's wonderful stuff. Okay? Life is more about fulfillment than just achievement. We're obsessed with just being high achievers. It doesn't necessarily make you happy. Okay? I want you to really hammer this message home to you. I want you to really play this in your mind over and over again, that life is about fulfillment than just achievement. Because there's plenty of people out there, I have patients, who are high achievers outwardly. Okay, they've done really well in their careers, financially they're strong, they've got a beautiful family, they've got everything they want in life, but they're actually miserable, okay? Because they don't feel fulfilled, because they haven't figured out what they need to feel fulfilled. Okay, and we talked about healthy self. If you separate it, if you have a healthy self, you will heal yourself. Okay? Now, I'm conscious of not mentioning this because I'm not an alim. I'm just a miskeen, regular dude. Okay, but we can't deny this fact. Okay? This is the time where if you're struggling with anything, so put coronavirus to the side, or even with it here now, this is the time where you strengthen your faith. You cannot deny this fact. Okay? About the need to strengthen your faith, especially in these times. Okay, so this is a perfect time, and even if you put coronavirus to the side, if you really want to really get through this is the time to strengthen your faith, because the ulama, they say, La sa'id illa man asadahu Allah. There's no happiness except that Allah makes them happy. Okay, we have access to Allah subhanahu wa ta'ala, who can change hearts, minds, souls, the universe, because He is ala kulli shay'in qadir, and you have access to it. Now, okay, yes, it's a tragedy that our masajids won't be performing Salatul Jama'ah, but look, why don't you set your alarm now for the beginning time of Fajr? Okay, just wake up 20 minutes before Fajr starts for Qiyamul Layl, okay, a period where Allah actually is looking for people so that He can answer their needs. And this happens every night, not just in Ramadan. It happens across the globe, not just in Makkah and Medina and Masjid al-Aqsa. And this is the perfect time to connect to Allah, apologize for our wrongdoing, seek tawbah, seek His forgiveness, and ask for His help, His assistance, His guidance, His tawfiq to rectify things. This is the perfect chance to do it. Okay? Those of us that might have been distant from the masjid, make an intention that, no matter what, when they open again, and they will open again, inshallah, for when this settles, that I'm gonna make sure that I pray my salah in the masjid with presence, and I'm not gonna forsake my jama'ah. Because let's be honest, bros, some of us do this over a football match. Why would you do that? Why would you miss a jama'ah because of a football match? Okay, you can watch the highlights. Okay, make a commitment that from today, when it's time for them to open to the for Jamaat again, I'm going to make sure that I'm there, and I'm going to make sure that nothing is going to stop me. Okay, nothing's going to stop me, like things that are nonsense. Okay, commit. Those that haven't picked up the Quran, commit that from today I'm going to read X amount and I'm going to aim to do a khatam. Why? Because after a khatam, du'as are mustajab. Those of us that haven't learned Arabic to understand the Quran, commit. I'm going to commit to learning. There's loads of online classes out there. There's loads of self. You can teach yourself to a degree, but make an effort. From today I'm going to work on my soul and my character. I know I've got things that I need to work at, and I'm going to do it. Okay? There's lots of books that have been written out there. There's lots of ulama that you can still access through online, etc., to help you deal with these spiritual problems like showing off, or vanity, or pride, or wantonness of this world, or distance from the Sunnah. I'm going to commit myself to improving myself and getting closer to Allah and His Rasul sallallahu alaihi wasallam, because this is the time. Okay? And if you are feeling sad, remember the story of Abu Umama radiallahu anhu, where the Prophet ﷺ walked into the masjid and he saw Abu Umama sat down with his hands around his legs and his head down. And the Prophet ﷺ asked him, "Ma ajlasaka fi masjidi fi ghayri waqti as-salah?" What's made you sit in my masjid when it's not namaz time, when it's not time for salah? And Abu Umama said, "Ya Rasulullah, humumun ghalabatni wa duyunun rakabatni," that my sadness has overcome me, and I've got lots of debt that's overcome me. So the Prophet ﷺ said to him, what did he say to him? "Astaghfirullah, you have weak iman." See, the Prophet ﷺ was beautiful, inwardly and outwardly. He was, he said to him, "Awala adulluka ila kalimatin idha qultahunna adhhab Allahu hammak wa qada daynak." Should I not tell you a few words that if you were to say it, your sadness would go, Allah will remove your sadness and take care of your debts? "Bala ya Rasulullah, tell me." What was the dua? "Allahumma inni a'udhu bika min al-hammi wal-huzn wal-ajzi wal-kasal wal-jubni wal-bukhl wa min ghalabati ad-dayn wa qahr ar-rijal." Oh Allah, I seek refuge in you from hammi wal-huzn, sadness and worry; ajzi wal-kasal, anxiety and laziness; jubni wal-bukhl, being a coward and miserliness; ghalabati ad-dayn, overcome with debt; wa qahr ar-rijal, and people overcoming me. What did Abu Umama say? He said, I said it, فَقُلْتُهُنَّ فَأَذْهَبَ اللَّهُ هَمِّي وَقَضَى دَيْنِي. I said these words, and my anxieties, my sadness, Allah dealt with it, and my debts were paid off. Okay, you have to, this is what certainty, yaqeen does to you. You understand? This is what certainty and yaqeen does to you. Is that you have to, now fine, look, the ulama have I'm sure it's out there. There are masnoon du'as that you can read for protection, that the Prophet ﷺ gifted us. They're there. That's the greatest tool. Okay? But use this time really to connect and strengthen your faith and rectify what's wrong between you and Allah. Okay? And one thing, and the brothers will know my bias towards this anyway, but what were we taught by our late Hazrat Rahmatullahi alayh? He said this for years. He said, when you wake up in the morning, the first thing you should say is, Raditu billahi rabba, I am pleased with Allah being my Lord. Wa bil Islami dina, and my religion is as Islam. Wa Muhammadin nabiyya, and my Muhammad sallallahu alaihi wasallam as my prophet. And he said, you need to not just say it, you need to believe it from the depths of your heart. Morning and evening, as much as you can, say it. Because essentially, whoever says this, look at the wording. It's haqqun ala Allah. It's upon Allah to please that person who says this with deep belief and conviction. Okay? And so just make it a habit to say this in the morning and in the evening with meaning, and you'll find your day is a lot more easier than what it should be. Okay? We're one of the last, in fact, it was the last bayan of our Hazrat, Rahmatullah alayhi, in Bolton, in Masjid Zakariya. Some of you might have been there. It was a Bukhari khatam. And I'll finish with this. He said that one of his students had a dream. You heard this. Most of you would have heard this. One of his students had a dream that he was ascending from the earth to the heavens. And he kept on going higher and higher and higher and higher. And then he came to 2 doors. You heard this? No? He came to 2 doors. On one door was written Mazahi Maza, amusement, play and folly. And the other door was Hadith. a dars, a class of the narrations of the Prophet ﷺ. He said the student in the dream said to him that I thought about this, which way should I go? And then he decided to go into the door where it said hadith, the teaching of the narrations of the Prophet ﷺ. And he said right there, who was there? Was the Rasul ﷺ. And he was teaching hadith. And as soon as I saw the Rasul ﷺ, I started saying as-salatu was-salamu alayka ya Rasulullah. And what Hazrat said was, we're in a zamana, this was in Dhul Qa'dah last year. He said, we're in a zamana right now where we need to do two things. It's recorded, if someone wants to get hold of the record, it's out there. He said, we need to do two things. One, we need to let go of this mazah. What he meant is when you pass the boundary. Life isn't just about amusing yourself and filling your nafs with wants. He said, you need to let that go. And secondly, he said, look, this was then. He goes, Jai choti raat hai. In the summertime, the nights were short. He said, wake up and you need to cry. Because that's the one thing that will, help these trials and tribulations, is learning to cry in the middle of the night. So connect with Allah. Okay, this is one of the most important things, especially at this time. Okay, Jazakallah khairan for listening. We'll stop there, inshallah. Remember, change is possible. Never say it's not impossible. Sometimes understanding why is more important than how. Then you'll realize the need to change if you understand why. And remember, consistency is the key. You can't do it if it's not going to be one event. You can't go and meditate for muraqabah for one day and then you're fine, or you go and pray all your namaz in one day and then you're fine. It's consistency, that's the key. Okay? And remember, nothing happens without divine providence. Without tawfiq from Allah, nothing happens. So you have to turn to Him subhanahu wa ta'ala. And in conclusion to both seminars, this is a famous statement of the Prophet ﷺ: Ni'matani maghbunun fihima kathirun min an-nas as-sihhatu wal-faragh. Two blessings that most people are just not grateful for. They don't take any value for it, which is your health and free time. Okay? So take value. Okay, make a commitment that I want to look after myself, my physical health, my spiritual health, and my mental health consistently. Inshallah, you'll see changes with your physical and mental well-being. We ask Allah subhanahu wa ta'ala for tawfiq, help to implement what's been said, and most of all we ask Allah subhanahu wa ta'ala to descend His mercy. Those that are ill, give them shifa. Those that Allah protect everybody from this illness. Allah put unity in the hearts of the Ummati Muhammadi. Relieve suffering of people who are suffering in whatever capacity they're suffering. We'll stop there, inshallah. Assalamu alaikum wa rahmatullahi wa barakatuh. So one of the brothers asking, can the kids play football outside? It's a really common question. So if you go into an open area, like a park for example, in maybe 3 or 4, just have a kick about, not in clusters, because children can be carriers without real. Because it's interesting, children seem to be really dealing with it really well. They tend to be more carriers than actually being affected. But it's just about small clusters, and again with children, you should really seriously consider social distancing them from grandparents or those that are ill on the list of medical conditions, seriously, because they can be carriers without realizing it.
You mentioned about families and watching the news. What about the rest of the time on the phone, smartphone? What do you advise me? How long?
Yeah, so the question is, you mentioned 5 minutes on news. How much time should I spend on smartphone? Look, I don't have a smartphone, so if you can, I've never had one, and you know what? After this saga of what's going on, I don't ever want to get one. It's just been, there's been good coming out of it, but there's also been bad that's coming out of it. And unfortunately, we've got people who are not disciplined with tongue, and they just break hearts. They just break no respect for anybody. Elder, younger, their intelligence, their speciality, no respect. And essentially you're hiding. If you had a problem with me, okay, Safwan, I would expect you to ring me and say, why did you say that? And I wouldn't have a problem with that, because you're talking to me like an adult. But if you're hiding behind social media, right? No, it's like, what is that? Where's the human nature gone? You understand? So the reason why I say come off it is because, for me, I think there's more, at this moment in time, I think there's more breaking of hearts than what should be happening in terms of mending hearts and looking after people. Because I'm not on it, and I don't want to be on it, but what I hear, I was driving to work, driving here today, and my brother was telling me, make dua, this social media is it's just awful. Okay, make dua. What's happening? And I was in tears thinking, even at times like this, the problem is that we can't discipline ourselves. We just can't. So just as much as you can, just avoid it. So much fear mongering. People are just scaring people's pants off. This is the time where you give people hope. Understand? Yeah, exactly. Solution focused. Don't be like, but it's just awful. But as much as you can, just this is the time to disconnect and unplug. This is the time to disconnect and unplug, and then discipline yourself so that when life does go back to normal, you can actually control yourself. You spend more time with the Book of Allah or reading something about the Rasul Sallallahu Alaihi Wasallam or rectifying yourself than wasting your time on social media and looking at nonsense and letting hours pass by. The average person spends about 6 hours a day on social media, literally doing nothing.
One last question.
Ji.
How can we keep a balance between fear and hope? Some people become overburdened with their sins and they become hopeless and anxious.
So the question was, how can we get a balance between fear and hope? Yeah? Because some people, say that again? Some people
become overburdened with their sins.
Overburdened with their sins, subhanAllah. I'll tell you something, okay? And I don't mind saying this because you're all connected to our late Shaykh, rahimullah. I said this to him once. And he said to me? He said, and this is what I loved about him, because he was just matter of fact. First said, Are? In other words, stop. You know what we're talking about? Stop. Are? Why are you thinking like that for? Stop. Rethink. He said, do you believe in Allah? I was like, yes. Of course I do. He said, do you believe He's Ghafurur Rahim? I said, طبعا بدون شك. Of course I do. He said, خلاص, did you make tawbah? I said, yes, I did. He said, did you do it with the conditions? I said, yes. He goes, خلاص, forget about it. Allah's Ghafurur Rahim. Understand? You have to, but there has to be a balance in the sense that if you feel you're overwhelmed because of khawf, that's when raja comes in, and that's what the Shaykh did to me, because I was overwhelmed with khawf. Doesn't mean that I've completely forgotten about my sins, because you remember them, because you have to keep yourself in check. But you have to have that, that narrative in your mind. You know the verse, قُلْ لِعِبَادِيَ الَّذِينَ أَسْرَفُوا عَلَىٰ أَنفُسِهِمْ لَا تَقْنَطُوا مِنْ رَحْمَةِ اللَّهِ إِنَّ اللَّهَ يَغْفِرُ الذُّنُوبَ جَمِيعًا إِنَّهُ هُوَ الْغَفُورُ الرَّحِيمُ. Now, when you look at that, if you translate it word for word, right? قُلْ يَا عِبَادِي. Like, what a pyara way of saying it. That's Allah's love right there. Oh, my servants, my bondsmen and women, mine. You don't say mine. There's an attachment there, isn't there? وَلِلَّهِ الْمَثْلُ الْأَعْلَى. We don't, لَيْسَ كَمِثْلِهِ شَيْءٍ. Allah has no emotions, right? But if you want to understand it in a sense that's Allah's pyar. Okay, number one. Number two, إِنَّ اللَّهَ يَغْفِرُ الذُّنُوبَ جَمِيعًا. He didn't have to say inna. Allah could have just said Allahu yaghfiru dhunub. He said inna to stress definitely, certainly, absolutely, no questions asked. Okay? Jami'a, every single sin apart from shirk, what we know from the Quran. Every single sin. Now, whatever sin you've done, man, that's like, man, that's just great. I've got time for tawbah. Then what does he say? Again, innahu, indeed he, huwa, he, again. Now, because you're ulama, what we learn from language is that whenever there's kathratul huruf or kalima, kathratul ma'ani, that's what we get taught when we study basic Arabic. Then there's more letters or words, it amplifies the meaning, right? Innahu, indeed he, huwa, is al-ghafur, the, which has more of a meaning than just ghafur. So in other words, Allah has emphasized about 6 times. I mean, how much more emphasis do you want? And you have to have that Because remember, you have to have a husn al-dhan billahi subhanahu wa ta'ala. You have to. And that, so, but if you find, what ulama say is that if you find you're going over the hope and you start being lax, that's when khawf needs to come back in again. But to do this, you can't do it on your own. You need to have a master. You need to have a spiritual master who's traversed the path, okay? Who's traversed the path and who's done this, mastered their soul, and is qualified to teach other people to do it. You have to be with these people, especially at times like this. We need them more than ever. I mean, how many of us are missing him? How many of us, this? So for this person, I'd say, to get to understand this, you need to be with, a sheikh, to do all this. One thing that brought to my mind that I forgot to mention. Sheikh Abul Hasan al-Shadili, rahimullah, one of the 4 shuyukh of Turuq. The scholars came to him because they had a bit of ishkal, a bit of doubt about the concept of purification of the soul. So they came to him, and when they came to him, he said to them, "Have you prayed?" And they said, "Yeah." He said, "Are you sure you've prayed? Do you know how to pray?" And they were scholars, and they said to him, and I'm not having to dig at anybody, so you have to put disclaimers on, don't you, nowadays, because people start saying you're having to dig. I'm not having to dig at anybody. This is a lesson to me. He said, He said, "Of course we are." He goes, "We're ulama, we know how to pray. If we don't know how to pray, who knows how to pray?" And then he said to them, Shaykh Abul Hasan al-Shadili, he said to them, "Have you prayed this prayer? Innal insana khuliqa halu'a." Indeed, insan is created in an anxious state. إِذَا مَسَّهُ الشَّرُّ جَزُوعًا. When affliction or things that aren't good fall upon them to the effect, they panic. وَإِذَا مَسَّهُ الْخَيْرُ مَنُوعًا. And when good comes to them, they become miserly and they don't share the good. إِلَّا الْمُصَلِّينَ. Except those who pray. When we talk about connecting to Allah, I forgot to mention it. Prayer is the biggest. If you want to sort your anxieties out and your mental health, prayer is one of the biggest mechanisms to do that. إِلَّا الْمُصَلِّينَ. And then Surah Ma'arij in the 29th juz. And then all those other things. But the first thing he said to them, "Have you prayed?" And all the scholars made tawbah. They said, "We haven't prayed that prayer. We haven't prayed that prayer." Isn't that ajib? Who thinks like that? Unless you are someone who is, but he's gone, what can we do? Rahimahullah. Yeah. If there's any more questions, we'll stop, inshallah. Bas, we'll stop there. Jazakallah khair. Apologies if I said something that offended anybody. Really, that wasn't my intention. So please don't start sending WhatsApp messages because I'm not on WhatsApp or social media. If you have a problem, just ring me. Jazakallah khair. Assalamu alaikum.
Slides.
The slides are separate. I'll try. I'll give you a login to the
We're going to look.
A software that takes time. Let's go with it.
Why didn't it work? How come?
Yeah, but we didn't test the audio on it. So when you went to the slides, the audio would go off.
No, so if you have been through Zoom, you can share Zoom on YouTube as well.
Only 40 minutes.
What can you say?
But I had something else. Something else with StreamYard. I was using it.
You guys are ulama. Did I say something out of line?
Oh, it's very good.
No, but honestly, don't be like, you have to tell me, because the problem with Juhal like me is that you just go off on one without thinking about